Have you ever felt a little off? Maybe a bit tired, a bit dizzy, or just not quite yourself? Perhaps you blamed it on a busy day or simply getting older. We often do. But what if those subtle feelings are whispering something more important? Something easily overlooked, yet critically vital to our well-being. Let me tell you about dear Mrs. Eleanor. She was a vibrant woman in her late 70s, always active, but recently her family noticed she was a bit more confused, even agitated. She'd complain of muscle aches and headaches. They thought it might be the start of something serious, a deeper health issue. They took her to the doctor, worried sick. After a thorough examination, the doctor's advice was simple, almost disarmingly so. She's significantly dehydrated. Dehydrated? It seemed too simple for such concerning symptoms. Yet, with proper fluid intake, Mrs. Eleanor was back to her bright, clear-minded self in just a few days. This story, dear friends, highlights a silent health crisis that often hides in plain sight, especially among us as we age: dehydration. It's a common issue, easily dismissed, but with potentially severe consequences. Why is it that we, as seniors, are particularly vulnerable to dehydration? Our bodies change. Our sense of thirst can diminish. Medications might increase fluid loss, and sometimes, simply getting up to get a glass of water feels like too much effort. This makes understanding and preventing dehydration not just important, but absolutely essential for maintaining our health and independence. So let's explore why even mild dehydration can be a hidden health killer, and what we can do about it. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 10. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. First, let's talk about why dehydration is so dangerous, particularly for older adults. One of the big impacts is on your body's overall metabolism. Think of your body like an intricate machine. Water is the lubricant, the coolant, and the transporter for everything happening inside. When you don't have enough water, this machine slows down and starts to struggle. Your body can't absorb nutrients as effectively from the food you eat, and it struggles to get rid of waste products. This disruption affects everything, from your energy levels to your ability to think clearly. Secondly, dehydration puts a significant strain on your cardiovascular system, your heart and blood vessels. When you're dehydrated, your blood becomes thicker, making your heart work much harder to pump it through your body. Imagine trying to pump thick syrup through a straw instead of water. This increased effort can put undue stress on an aging heart, raising the risk of heart problems like irregular heartbeats, or even more serious events like a stroke or heart attack, especially if you already have existing heart conditions. Thirdly, and critically, your kidneys suffer. Our kidneys are truly unsung heroes, filtering waste and toxins from our blood, regulating blood pressure, and keeping our electrolytes balanced. They need plenty of water to do their job properly. Without adequate hydration, their filtering ability is compromised. Over time, chronic dehydration can lead to serious kidney damage, even kidney failure, which is a life-altering condition. So, how can you tell if you or a loved one might be slipping into dehydration? The signs can be subtle at first, but they become more pronounced as dehydration worsens. One common sign is what you can see on the outside of your body. Look for a very dry mouth and tongue. Your skin might feel less elastic. If you gently pinch the skin on the back of your hand, it might take a moment to spring back, rather than immediately flattening. You might also notice your eyes look a bit sunken or hollow. These are visual clues that your body is crying out for water. Next, consider changes in your body's normal functions. Are you going to the bathroom less frequently? Is your urine darker than usual, perhaps a deep yellow or even amber color? These are strong indicators. You might also feel a general loss of energy or feel fatigued much more easily than usual, even after minimal activity. Simple tasks suddenly feel like a monumental effort. Finally, dehydration can affect your nervous system, leading to more serious symptoms. You might experience persistent headaches or feel dizzy, especially when standing up quickly. Some people report feeling unusually sleepy or lethargic. In severe cases, dehydration can lead to confusion, disorientation, or even fainting and a loss of consciousness. If any of these serious symptoms appear, it's a clear signal that urgent medical attention is needed. The good news, dear friends, is that much of this is preventable. Taking proactive steps in our daily lives can make a world of difference. First, let's cultivate healthy daily drinking habits. Don't wait until you feel thirsty. By then, you're already a bit dehydrated. Aim to drink small amounts of fluid frequently throughout the day. Keep a water bottle or a glass of water nearby as a constant reminder. For many older adults, about 6 to 8 glasses of water or other fluids a day is a good target. But remember, listen to your body and consult your doctor about what's right for you, especially if you have specific health conditions. Secondly, you can get a lot of water from the foods you eat. Think of your plate as another source of precious hydration. Many fruits and vegetables are packed with water. Juicy options like watermelon, strawberries, and oranges are excellent. So are cucumbers, lettuce, and celery. Soups and broths are also fantastic ways to boost your fluid intake, especially warm ones, which can be very comforting. Lastly, be extra mindful during special situations. When the weather is hot, or if you've been more active than usual, you need to increase your fluid intake. If you're feeling unwell, perhaps with a fever, vomiting, or diarrhea, your body loses fluids rapidly, and you'll need to replenish them aggressively. Medications can also increase fluid loss, so always discuss hydration needs with your doctor or pharmacist. A little extra vigilance goes a long way in these scenarios. What if, despite our best efforts, dehydration does set in, or you suspect it has for a loved one? Knowing what to do next is crucial. The first and most important step is to seek medical attention promptly. Don't hesitate or try to manage severe symptoms on your own. If you or a loved one are experiencing significant dizziness, confusion, severe weakness, or very dark urine with little output, call your doctor or emergency services right away. A medical professional can accurately diagnose the level of dehydration and determine the best course of action. They might check blood tests to assess electrolyte balance and kidney function. For mild to moderate dehydration, a doctor might recommend oral rehydration solutions. These special drinks contain a balanced mix of water, salts, and sugars, which help your body absorb fluids more effectively than plain water alone. They are especially useful if there's been fluid loss from vomiting or diarrhea. For more severe dehydration, especially if someone can't drink fluids or needs rapid rehydration, intravenous IV fluids might be necessary. This involves getting fluids directly into your bloodstream through a drip in your arm, quickly restoring your body's fluid levels. If you are caring for someone who is dehydrated, gentle home care is also very important. Once medical advice has been given, encourage them to drink small, frequent sips of water or rehydration solution. Offer ice chips or popsicles if they find drinking difficult. Ensure they get plenty of rest to help their body recover. Keep a close eye on their symptoms, noting any improvements or worsening, and communicate these observations with their healthcare provider. Remember, Patience and gentle encouragement are key. Dear friends, our health is our most precious asset. Dehydration is a common, often overlooked threat, but it doesn't have to be. We've talked about its serious harms, the subtle signs to watch for, and most importantly, the simple, practical steps we can take every day to prevent it. We also covered what to do if it does happen, by paying a little more attention to our hydration habits. By listening to our bodies, and by caring for those around us, we can avoid this silent health crisis. Let's make a commitment today to hydrate ourselves well, to encourage our loved ones to do the same, and to cherish our health with every glass of water. Our vitality, clarity, and overall well-being truly depend on it.